big segment of my work is focused on trying to understand whether or not what we observe to be disparities are true, or whether or not there's some reporting problems in the way that we collect data, the way that we ascertain disease rates. Because in large part what we know about disparities comes from self-reported, what we call self-reported data. So survey folks will go into the field and ask people in the community about whether or not they have certain diseases like asthma or cardiovascular disease, and they check mark yes or no, and then they just go through a long list, and then we look at those data at the end in aggregate and try to figure out, okay, did the African Americans respond differently than the whites? Did the Hispanics or Latinos respond differently than the whites, or differently than the blacks, or the Asian Americans, etc.? And then we determine whether or not there are disparities. Not one researcher is going to have a profound impact on any particular health outcome, but it takes a lot of researchers trying to understand and study different aspects of these problems that are typically complex, and coming together and coming up with solutions that can inform policy and it can inform health education. I focus a lot of my work on kids, and it's this idea that if we can't get kids to engage in healthy behaviors at a very young age, the behaviors that they learn, so if you grew up in a family or a home environment where you were eating irregularly, you were eating fast food, you're very likely to be obese, but also grow up to be an obese adult. And also, if you are in a home environment that doesn't support or encourage physical activity, you're very likely to grow up to be an adult that won't exercise and will probably have a lot of health problems as a result. I think those two factors alone, if we could get people to eat well and to exercise more, would reduce or eliminate a lot of the disparities we observe in certain communities.